Welcome to Real Health Chat, our stories of health, justice, and change. I'm Julie Hard, Director for Global and Community Partnership in York's Faculty of Health, and this is where we sit down for authentic conversations with the researchers, educators, students, and community partners who are building healthier worlds right here at York University and beyond. No lectures, no jargon, just real people sharing the work that's creating upstream change in our communities. Let's chat. Today, I'm joined by Brian Londoño Escobar, a student leader at York University's Agents of Change program, an innovative initiative supporting student-led community projects that address social determinants of health and the UN SDGs. Brian is doing life-saving work through York University's Blood Initiative, or UB. Can I call it UB?
Yes, that's what we all call it.
Okay. This is a project that's focusing on blood donations and organizing expert panels on hematological disorders. UB's work aims to alleviate blood insecurities in the Greater Toronto Area through partnership with the Canadian Blood Services and making donation opportunities accessible to students. I'm excited to dive into how they're turning student passion into life-saving action and what it means for building healthier communities. So welcome, Brian.
Hi, Julie. Thank you very much for having me, and York for having me here for doing this little podcast with you today.
Well, we're excited you're here. And I wanted to actually get started with something that might surprise the listeners. So, Brian, in a previous conversation that we had, you mentioned that representation and diversity in blood and stem registries can literally be the difference between life and death. What did you mean by that? And can you share a little bit about blood insecurity in the Greater Toronto Area?
For sure. So overall in Canada, about 15% of all of the blood that we even get in the first place is from volunteers, and the rest is imported from other places like the US. So one thing that's huge and that the Blood Services knows, and UB's trying to help motivate and incentivize the students, is to realize that even international students are able to donate blood. This is something that a lot of students believe that, oh no, because I don't have my citizenship already, or oh, I'm just a PR, or I'm just on a student visa, that I can't donate blood as well. The blood donation centers here in Canada are trying to motivate and, make students realize, hey, you can also be that step that saves the people that are in the hospital. You maybe want to take the steps of being part of the Canadian community. Maybe you can do your part as well and, trying to donate plasma or trying to donate blood here in the GTA. So that's one thing that a lot of students never knew in the first place. And even when we speak to students and do outreach, we let them know, hey, are you interested in donating blood? Are you interested in donating plasma? And they say, oh, sorry, I can't. I'm an international student. And they always thought that that was a barrier. That's one of the big problems with our international student communities. They believed that was a barrier the whole time. But when we spoke to Blood Services, we brought up that concern to them. And they said, well, a lot of students are bringing this up to us, but, we're doing outreach. We don't have the guidelines. Is there a specific rule that says international students particularly can't donate? And they said, no, not at all. As long as you actually meet the checklist, because the checklist just is in regards to maybe some medications or your medical history, just so there's no concerns for the actual donation itself. But there was never a checkbox that said, are you an international student? Can you donate blood? Yes or no? Never. So that was one thing that the students never knew. But now we can, share it to the student community that we have here, let them know, hey, you can participate if you'd like to as well, and take that step into helping the Canadian healthcare system, of course.
That's great. Actually, you bring up a good point that most students probably actually don't think very much about the blood shortages and their role in it. So what made you realize that this is something that needs to have student action or student involvement?
For sure. So for me, it always started with the way my parents motivated me. They always told me that, being part of the greater picture is trying to help the community, the healthcare community in the first place, from the small actions that you can take. Even though I'm not in the hospital right now, I am able to do my part in donating something that is a tool to save someone's life. So originally, it always started with my parents. When they were back home, they said that one part of being, part of the bigger country and everything is doing your part to donate the blood, donate the plasma whenever you can and if you're able to. And then when they had me here, they were like, okay, you have to be part of Canada. You have to do your part to making Canada amazing, Canada's healthcare system safe and stable, because they were very appreciative to the fact that when they came here, they had a healthcare system that was socially covered. It was something that was stable. It was something that was always there as their backup if they needed that help. If they were sick, they always went to a doctor. And if they had to go to a hospital, they always had the support there in the hospital as well. So they always told me, it starts with yourself. And what better than actually creating outreach in your community, which is York University. And as a health science student, they wanted me to be part of that change. So the big picture was saying, okay, Bryant, maybe the things that you can do right now is doing outreach, because if you're able to spread the word, share awareness about these situations or about all of these initiatives that are happening at York, maybe it can be that change that gets students to actually go donate. Because the York University's community is huge. We have a lot of students, especially in health science. We have all the nursing students, we have kinesiology students, health studies students, we have psychology students. A lot of them are interested in doing it, but they don't even know where to do it in the first place. And one of the big problems is accessibility to those things. As a student, having to dedicate time, trying to find where you're going to go, coordinating it with going to your next class. So that's one of those things that really started pushing the narrative of I can do my part and also motivate students to come and donate was my parents from the beginning.
Yeah. Can you actually take a step back and maybe tell us a little bit about the scope of this problem? Like, how big is the problem of blood in the GTA? Who's most affected? And what are some of the consequences of when low blood supplies or when blood is running low in our communities?
For sure. So in essence, blood is life. If you get in a car accident and your leg gets hurt or your arm is hurt and then you're bleeding out, the first thing that when you get to the hospital is that they're going to try and connect you to the blood that obviously is the one that matches you in the first place. Right. Everybody has different groups of blood. And if you don't have the one that meets you, depending on what group you are, then you might not be able to access that blood. The issue is that if you're not able to access that blood in time, it's the difference between life or death. So understanding those things from the beginning, just understanding that it's not just something that you can imagine, or you can't just talk to someone and work out their problem of running out of blood. It's a tool that you actually need in the first place. A doctor can't do their job if they don't have the tool. A nurse can't do their job if they don't have their tools. It's like telling a plumber to try and fix a pipe with a hammer. Uh-huh. He needs the tools that he needs, or she needs the tools in the moment that she needs them for that particular action. If a doctor or a nurse or any healthcare practitioner in that field doesn't have that essential tool for life, then they can't save the person's life in that moment. And there's so many emergencies that happen daily. The difference within actually doing the outreach is that, for example, the Plasma Donation Center, they collect like 300,000 liters of blood in a year, even more. And these things have only gone up in the last years, but because they've noticed that the outreach is what's changed so far. They know that spreading the word and understanding that people took the fact that blood donation was important, but they didn't realize that it could be sincerely the difference between life and death. So they've gone up, like even from 2023 to now, they've gone up almost 25% in donations, just from the sole fact of reminding people, hey, blood is the difference between life or death sometimes. And you can be that change by just going to donate once a year.
Yeah. Well, you mentioned some of the barriers. So what are the barriers that prevent students from engaging in giving blood, or people in general? What barriers kind of exist here in our campus and in the community that you could share with us?
For sure. So if I talk specifically about my situation for health science students, we live test to test, assignment to assignment, study to next study group. We're always living on what's the next thing that we have to do? What's the next deliverable that this course requires us to get in? The problem is a lot of us don't have a lot of time. Mm-hmm. So when you really look at the bigger picture, it's us saying, okay, we either sacrifice studying for a test or going to donate blood. So we think that when we prioritize ourselves in the situation, we have to look towards trying to get through our studies. But what we've been trying to work with actually in the blood donation centers is trying to be able to be that mediator and get people there and back as fast as possible so you can make it to your next test or you can make it to the next assignment. So the problem is time. It's one of the biggest barriers because whether you're at school, whether you're going to work, because a lot of us work full-time or even part-time jobs, depending on what our situations are. Yeah. So we can't just run between the university and then, let me just go donate blood for an hour or two or whatever it is, and then run back to the university. That's the difficult part.
So walk us through what you're actually doing with UB, how you're working to address the blood shortages, address some of these barriers, and basically increase donations. Because it sounds like there's a willingness of students or there's a willingness of people to give. How are you addressing that?
For sure. So one of the biggest initiatives that UB's taken on so far is working directly with the Vaughan Plasma Donation Center. And what we've done so far is they have a blood bus that that's just the name that they call it, the blood bus.
The blood bus.
Yeah.
It's pretty ominous.
So what happens is that we coordinate with them. The idea is that we're trying to do it monthly. And then the goal is that we're going to get a bus. We do sign-up sheets. And then students that are interested in donating blood, we set up a date throughout the month where we're going to try and collect a list of up to, I think it's about 20 students in the bus so far, because we're just trying to ramp up like the outreach with this program. And the idea is that we take them there to the Plasma Donation Center, and they set it up as a little lunch meeting. So what they do is at the donation center, they bring some lunch for students, so they don't have to bring lunch that day. All the students that sign up, they get picked up here at Tate McKenzie at the gym, and then we drive right from here at York straight to the donation center. While everybody's checking in, signing in, getting hooked up to donate the blood and everything, it's like a lunch break. You go there, you eat pizza or you eat a sandwich or whatever it is, the lunch of the day. You talk with everybody and you just relax while you're there donating blood. The moment you're done donating blood and lunch is over and everybody's completed, then we drive everybody back here to Tate McKenzie, and then you call it a day.
Amazing. So just because you mentioned it, so somebody might be thinking, how come you're just not having these blood drives here at York University? Wouldn't that be easier?
It is. So they have had it in the past before, but the problem is with plasma specifically is that it's a very large machine for donating the actual plasma. It has to go through a centrifuge system after it's gone through, like the blood is, there's a needle that goes into your arm, which is what extracts the whole blood in the first place. But then it travels through this system that it has to go through a centrifuge, which means it spins very fast, and then the blood is separated. So that's how they're able to pull out the plasma and take what they need in that moment, and they return back the red blood cells into your arm as alongside saline. So the problem is with plasma, because the closest center that we have for donation is the Plasma Donation Center. They can't bring those machines here. And another problem to that is that they can't bring multiple machines in the first place. Right. So even if they could bring machines over, if they bring one or two, each donation for plasma can take up to about an hour. So if they're hooking up one student at a time, 1 hour at a time, it's not very efficient.
Got it. I'm going to change gears a little bit and just say that this project is part of the Agents of Change program. So how does the Agents of Change program support this system and has enabled you to turn the idea of UB into action?
For sure. So they really were a key part in allowing us to even promote the program on its own, because the initiative itself started very small. It started with 2 motivated students in kinesiology that were actually classmates of mine, and why I even found out about UB in the first place. Especially Nusha, she was one that I used to sit beside in class, or I've had tutorials with her in the past. And it all started with their idea of, okay, how can we make change at York?
Can you name them? You can name your friends, can you not?
Yeah. It started with 2 kinesiology students. It was Nikon and Nusha. And the reason why I even met them in the first place was because we were in class together. So when I was sitting at the front, I mainly talked to Nusha at first. And with her, she was discussing with Nikon at the beginning, hey, how can we bring outreach to the university about some important health issue in the GTA that affects students overall, or even the York University community, anybody in the area? So when I first heard about the initiative, I was like, okay, well, things are moving somewhere, something's happening. So what I did at the beginning was I started connecting directly actually with the Canadian Blood Services here at the Plasma Donation Center at Vaughan. So I used to speak to one of the managers there, which was Michael, and he was coordinating everything. He was like, okay, we're trying to do outreach events. We're trying to figure out what's going to happen here, what's going to move this project forward. And he always told us, he says, okay, whatever I can help you guys with, let me know. Like, I want to try and be that person that makes a change with the students. So what happened is we went back to UB. They started discussing with them the regional manager, which was somebody else in the Canadian Blood Services organization. And we discussed, okay, we have an opportunity here. We have the students that are willing to do it, and we're interested in how we can figure this out. Took a couple of months. They went over discussing with the regional managers. I went discussing with Michael. And then back here at York, it was discussing with Bisma, for example. She was another one of the students, and she's one of the social media executives at UB. And we were figuring out, okay, we're going to make posters. We have to put this on socials. How are we going to motivate students to come? And what is our goal? Our goal was, okay, if we can get students to donate at least once a month or even once a year, the change is big because it motivates and shares the word and spreads the awareness of, hey, we should go donate plasma to develop these medicines that save lives, or go donate blood to save the people in the hospitals in the first place.
Great. And then just to kind of circle back, you mentioned critical representation and diversity in blood and stem cell registries. Do you want to comment on, and can you break that down, why it matters so much?
For sure. So blood is one thing, plasma is one thing, stem cells is a whole other thing in the first place. When you're going to donate stem cells, it's not that you go and, hey, I'm going to go to a stem cell bank and just donate my stem cells. No. What happens is you have to actually swab and test first. When you go to the blood donation centers, after you donate plasma or after you donate blood, they're going to ask you, hey, would you like to join the stem cell registry? They're going to bring to you 2 Q-tips, or 4 Q-tips actually, sorry. And they're these just big cotton ball Q-tips, and you have to rub them in your cheeks. Once you put them in this envelope, they're sent over to a DNA testing facility because they have to actually see what specific DNA group you fall under for the stem cell registry. They're going to put you in a huge database of stem cell donors. And the moment you get called, it means that somebody out of 1 billion people, or however many people are in this registry and however many people have actually put their name in the list, you've matched out of that multitude of people, and you're the one person in that moment that can actually save this person's life. They're going to call you. They're going to say, okay, I know there's like a 1% chance that you're going to get called for this, but clearly there was one person that matched you, and then you have to go in, and then they're going to do an intake process for you to actually donate the stem cells.
Wow. I actually have goosebumps on that. That's really crazy.
So it's a lot. You have to be very, very specific because the stem cells is something where you have to be a perfect match for this person. It's blood. There's groups, which is more generalized to, let's say, like there's some people are 10% of this group, 30% of this group, 25% of this group. Stem cells, you're like 1 in 300,000 if you match with somebody. So it's very, very unlikely to get called. But if you are called, you're that one person that can save them in that moment.
Amazing. So this has been such valuable insight into student-led health advocacy and the work that you're doing at UB. And before we finish up, I also just like to run a few rapid-fire health questions just to get to know you a little bit. These can be related to UB own personal health philosophy and journey.
Hope I can answer them.
Well, I think they're kind of for fun, right? So let's just give it a whirl. I'm going to go really quickly, and just like the first thing that comes to mind, you can answer. And so are you ready?
I'm ready.
Okay, here we go. So name one healthy activity you think everyone should engage in.
Drinking water. I feel like students don't drink enough water.
Great. Name one health trend that you wish you'd never subscribe to.
I think it has to be I don't know. A health trend that
How about one you will never subscribe to?
One that I would never subscribe to, water fasting.
Okay. That kind of follows on your first response.
Yeah. Okay. Enough water, but not too much water, and not eating.
How about one health myth that you believed in for way too long?
Not necessarily maybe a myth, but I think the people say, oh, you just drink apple cider vinegar in the morning, you're going to lose a bunch of weight. Well, no, you have to watch your nutrition overall.
That's a good answer. True or false? Tim Hortons coffee counts as a health intervention.
True.
True. Okay.
Yeah.
We have a coffee lover in the house.
Yeah.
Okay, so maybe some blood-related questions. Now I'm going to test you on this one. So true or false, giving blood counts as your cardio for the day since your heart has to work harder to make more?
False, but I wish it was true.
Great. Is the free cookie after donating blood technically a medical prescription?
I would say so, yes.
Okay. And what advice would you give to someone who claims to have trypanophobia, which means fear of needles, if they want to give blood?
Well, I would say still go, try it out, look away, and let them, poke you.
And just a pinch.
Just a pinch. Okay. Actually, before I forget to say this, the needle for the blood donation centers and plasma donation centers hurts less than the needle than when you go to a Life Labs. Because what happens is the metal of the actual needle is different and it glides in a lot smoother than the ones that you go at a regular lab. So the consideration is that the needle is bigger. You do think it's going to hurt more, but it actually glides in easier than the ones at Life Lab, the butterflies or the other ones, because the metal it's made actually hurts more when it drags in. The one at the plasma donation centers has no drag when it goes into your vein.
Oh, see, now we've learned something, and maybe that alleviates some fear for listeners that might be considering it. So that's a wrap on this episode of Real Health Chats. Bryant, thank you so much for sharing your incredible work and the work of UB and its insights with us today. For listeners who want to get involved, whether it's donating blood, joining the stem cell registry, or connecting with UB, what's the easiest first step for someone to take today?
So the easiest first step really is just doing what we do every day. Go onto social media, go onto Instagram. You can either check directly with the Canadian Blood Services. Their Instagram is Canada's Lifeline, or you can go on to York University Blood Initiative, which is UB's Instagram. And we post a lot of content on there, trying to create awareness for the students to be able to see what the process is like, try and alleviate some of the stress, like the fear of actually going there in the first place. And there's a lot of links there for the resources to sign up to donate blood, donate plasma. Same thing with Canadian Blood Services. So go on the Instagram, find some information there, and then let's get not scared of actually donating the blood, because it's a little less scary than you would believe it is.
Fabulous. Thanks, everyone. Real Health Chats are produced right here from York University's Faculty of Health in the Real Health Studio. For everyone listening, if today's conversation resonated with you, we'd love to hear about it. And if you're working on something that's building healthier communities, we'd love to hear about that too. Send us an email at eehealth@yorku.ca. Until next time, this has been Julie Hard, and we'll chat soon.